Welcome to your Aged Care Compass podcast. Join us to find out how to support your older loved ones at home. We're going to help you make sense of Australia's aged care system. We talk about legal and financial considerations for ageing and how chronic health conditions impact your older loved ones' well-being. And we share real-life stories of where it went wrong for people and how we got them back on track.
Hello again, listeners. Michelle here. We had such amazing feedback after our last Ask Me Anything episode that we decided to devote one podcast a month to answering your questions.
Our first Ask Me Anything episode is actually our most listened to, most downloaded episode, Shell. So let's jump right in and answer the questions you've asked us today. We're covering a few different topics.
Okay, Coral, first question. Why doesn't my package provider cover the full cost of my pre-prepared meals like Light and Easy?
Home care package funds can't be used to purchase food. So what the package funds are covering is the preparation of the meal, not the food component as such. The government will allow providers to cover 70% of the cost of a commercially prepared meal. The other 30% is regarded as the actual food component and not covered.
Okay. Coral, what's the difference between the basic daily fee and the income tested fee? And why do some providers charge these fees and others don't?
Yeah, look, this question gets asked all the time. So the basic daily fee is not a mandatory fee, unlike the income tested fee. So providers can ask someone to pay the basic daily fee, but it is negotiable. It's not mandatory. Some years ago, providers who marketed themselves as charging very low fees, and this was before package management and care management fees. So these providers would say, you know, our admin fees are only 10%, and then they would charge the basic daily fee on top of that. But after the government stipulated the maximum amount of combined package management and care management fee being no greater than 35%, we saw less providers charging the basic daily fee. So the basic daily fee is charged at between just over 15% to 17.5% of your aged pension. And the basic daily fee is indexed each March and September in line with the age pension. The income tested fee is determined by Services Australia and not your provider. If Services Australia determines you have the means, that is the income, to contribute to your package services, your subsidy or funding is reduced by the amount that you have to contribute.
Right.
So people who will not have to pay the income tested fee are those on a full aged pension and people with an income of up to $33,735 a year. The My Aged Care website has a fee calculator, so you can work out if you would need to pay the income tested fee or not. We've popped the link in the show notes if you're curious to see if you'd have to contribute this fee or not. We've been asked about these fees in the new Support at Home program. Now, there are a lot of questions around the new fee structure or co-contributions under the new program, but as the new Act hasn't been passed in Parliament yet, we're not going to add to the speculation as, you know, the consultation process may change what has been proposed currently. We'll actually dedicate an Ask Me Anything episode to the proposed changes once the Act has been passed.
Okay. Does the home care package funding affect a person's pension?
No, it doesn't. So look, just to clarify that a little bit more, the package funding is not income. It's not your income. Yep. It's a subsidised government funding that allows you to receive aged care support at home.
Okay. And going back to the changes that are coming, we're hearing that people who are currently in the system will be no worse off under the new Support at Home program. Can you explain what that means?
Yeah, so look, Shell, I don't want to elaborate on all the discussion around support at home because, like I just said, the bill hasn't been passed, so things could change. But just for the purpose of this question, grandfathering, or a no worse off principle, applies to people who, on the 12th of September this year, 2024, were either receiving a home care package, or they were waiting in the National Priority System, or the queue, or assessed as eligible for a home care package. The no worse off principle ensures that those people who are already in the system won't be financially disadvantaged as we transition to the new Support at Home program.
Yep.
So I just want to reiterate again, there is a lot of discussion. There's a lot of concern across social media and in the community right now about the proposed changes under the Act. What people are going to have to contribute. Will they be able to afford services within their home care package? The new Act hasn't been passed, so community consultation has just closed as well. So it is my preference to wait until we're certain about what the new program is actually going to look like before we begin explaining and commentating on what this is actually going to mean for people come July 2025.
Sure. All right. Coral, why can't I claim the cost of a visit to my doctor from my home care package?
So items or services that are already subsidised by the government, being federal or state, cannot be claimed from home care package funding. This applies to GP visits where there might be an out-of-pocket cost. There is already a Medicare rebate for GP visits. So although you'd have an out-of-pocket fee for visiting your GP, the rules are that you cannot pay that out-of-pocket fee from your home care package funding. Likewise, if you were to visit an allied health clinic under a GP care plan, let's just say a physiotherapist, you're likely to have an out-of-pocket cost as well. Now, some allied health clinics will bulk bill under a GP care plan, but many won't.
Okay.
So the out-of-pocket cost for visiting a physiotherapist or a dietitian or a psychologist, any allied health clinician, cannot be paid for from the package funds, as this service is already being subsidised under Medicare.
Okay.
Just following on from that point about allied health, if you're like my mum, who has allied health included in her care plan and has an exercise physiologist visit her at home each week, that service is paid for by mum's package provider because the full and unsubsidised cost is being met by my mum. So
Right.
no, the EP that comes to mum each week, that's not subsidised under Medicare.
Yep.
Mum is choosing to pay the full cost, and that's why she can have that full cost covered by her home care package, because
Yep.
it's not already being subsidised by Medicare.
Okay. And along those lines, do I need a letter of recommendation from my GP to get other allied health services through my home care package? So I guess things like physiotherapy, a dietitian, nursing care, or a podiatrist?
No, you don't.
FlexiCare is a not-for-profit organisation which supports older people living in Brisbane's southern suburbs to live their best lives in their own homes and communities. FlexiCare don't have grand plans to be the biggest aged care provider. They want to be known for treating each one of their participants as an individual who they get to know well. They answer their phone calls personally when clients ring them. They give their clients easy access to a home care partner who can work with them to deliver the best mix of support possible. If you're in Brisbane South and want to know more, give their friendly team a call on 07 3422 8400 or check out their website flexi.org.au. Coral, what is the dementia and cognition supplement and who can get it?
The Dementia and Cognition Supplement is an additional amount of government funding that people can apply for if they are moderately to severely cognitively impaired and they also have a home care package. There's a lot of confusion about the eligibility for this supplement. So you do not need to have a diagnosis of dementia to be eligible for this supplement or this additional funding. Impaired cognition can be caused by other conditions, not just dementia. It can be caused by a stroke, an acquired brain injury, mental health conditions, or even some medication. Eligibility for the dementia and cognition supplement is determined solely on the scoring outcome during the screening process. Eligibility for this supplement is separate from the investigative process that you might be going through with your geriatrician to perhaps determine a diagnosis of dementia, and it is also separate from the ACAT assessment. So a comment we often see is, why didn't my geriatrician apply for this for me? Or why didn't the ACAT complete the paperwork for this? Completely separate process. The screening for this supplement is separate to, investigations that a geriatrician might be progressing, working towards a diagnosis, and it's separate again from the ACAT assessment. Another comment we see is when people ask the hospital occupational therapist to complete the screening, and then they're annoyed when Services Australia decline that application. And unfortunately, what they think is that they aren't eligible or the older person is not eligible to get this supplement, when in fact, what they haven't realised is an occupational therapist or an OT is not one of the approved clinicians to complete the screening for this supplement. So in hospitals, OTs have a significant role in screening and assessing people for cognitive impairment. But for the purpose of this additional funding, OTs are not one of the approved clinicians. So if you've had an OT, complete the screening and then complete the application form, send it into Services Australia, it will be denied or declined because the OT is not one of the authorised clinicians for this process.
Right. So not because the person's not eligible.
Correct.
Right.
So the person might be eligible, but the OT is not allowed to sign off on the application form in this instance. Who can complete the screening? Well, GPs and other medical practitioners can, registered nurses can, and clinical psychologists can.
Okay. Why are home care providers making it harder for me to choose my own workers and then submit the invoice for payment? They say my workers need a service agreement with them.
Yeah, so this question would, I think, mainly relate to people who are with a self-managed provider for their home care package. So the aged care system is heavily regulated and the government wants to ensure that their funding is being used appropriately. So providers must ensure that workers have ticked all the regulatory boxes to be paid for from the government funding or package funding. So there are requirements such as a police check, there might be stat decs, the insurance policy, and the ABN of, let's just say, the worker. And that could be a non-clinician or a clinician. The government wants to make sure that family members aren't being paid for from package funds, and that your cleaner or your lawn-mowing contractor is a legitimate business. So, if you come to your provider, particularly if you are with a self-managed provider and you want to bring your cleaner with you when you sign up with one of the self-managed providers, then your cleaner will have to produce, certain documents like I've just described to be able to enter into a service agreement with the provider. And your lawn mowing contractor will have to do that. And your registered nurse will have to do that. Anyone that's involved in your care must have a service agreement with the provider.
Another question, Coral. I've been a bit worried about my parents for a while. I'm not sure that they're managing at home. What are some of the signs I should be looking for to know if I need to get help for them?
So I would say if you've been a bit worried about your parents for a while and concerned that they're not managing at home, you're probably right. Some of the early signs that people might notice are the older person not keeping the house as clean as they used to.
Mm-hmm.
They might not be managing to mow their yard. They might be losing weight. They might be leaving food out on the kitchen bench top. There might be some body odor, meaning that the older person is forgetting to have a shower each day, or they're wearing the same clothes day after day without washing them.
Yep.
The older person might not want to go out like they used to and prefer to stay at home. They might be calling you on the phone multiple times a day, asking you about appointments. They might be coming up with stories that might seem odd, such as accusing a neighbour of stealing their belongings.
Yep.
Now, these signs mostly relate to cognitive impairment, where the person may have thought that they've had breakfast, lunch, or dinner, but in fact, they haven't. Forgetting to put food back in the fridge when they finished eating it, or, leaving it out on the bench and the food is going off. These are early sort of signs that you would start to wonder that the person's cognition might be impaired, that there's something going on with their memory.
Yep.
There are also signs that relate to more sort of functional indicators, like becoming more unsteady on their feet and perhaps experiencing falls. They might be having pain that prevents them from being able to complete their activities of daily living independently. Not wanting to go out could also be an indicator of a mood disorder, or it might even relate to incontinence, that the older person might be afraid that they might have an accident because they can't get to the toilet on time when they're out in the community. So there are a lot of different signs, but one way of looking at it is if your older loved one is struggling to manage by themselves, and you find yourself providing more and more support, then this would be the time to contact My Aged Care and begin to seek formal support.
Right. And our final question, Coral, actually relates to that. So we were asked, I rang My Aged Care and I'm not sure what happened. They said someone would contact me, but I don't know what that all means. Can you explain?
When you contact My Aged Care and they've completed their screening to establish what kind of support you need, they will then refer you on to one of the two assessment teams. So this could be either the entry-level assessment team, which is the Regional Assessment Service or RAS, or the Aged Care Assessment Team, which is the ACAT. For both teams, there is an expectation that they will contact you to arrange an assessment within a specified time frame. So this is what My Aged Care is advising you when they say someone will call you.
Great. We get lots of questions and we try to answer as many as possible. As Coral mentioned earlier, because the changes that are coming with support at home are not yet finalised, we don't want to add to the confusion by answering questions that we don't have definite information for yet. There is a lot of speculation and, understandably, a lot of concern. As things become more definite, we'll be sure to let you know. Next week, we'll pick up our conversation about Dad's diagnosis of dementia and our experience of caring for him as the disease progressed. Thanks for joining us today. Until next week, take care. Hey Care community, thanks for listening to this episode. So you never miss a show, make sure you subscribe to our podcast. If you'd like to know more about what we do, head to our website, cmeacn.com.au.